Human papillomavirus, more commonly known as HPV, is one of the most prevalent viral infections in the world, affecting millions of people each year. Yet, despite its widespread impact, there's still a lot of confusion and misinformation surrounding HPV, how it spreads, the health risks it can pose, and the benefits of getting vaccinated. Today, we're going to break down everything you need to know about HPV, from how the virus works to how you can protect yourself and your loved ones. HPV is a group of more than 200 related viruses. Each type of HPV is given a number, known as its HPV type. Some types of HPV can cause warts on different parts of the body, while others are considered high risk, because they can lead to certain types of cancer. It's important to note that not all HPV infections are dangerous, and most people who contract HPV never develop any health problems at all. HPV is incredibly common. In fact, most sexually active people will get HPV at some point in their lives, even if they have only a few sexual partners. The virus is transmitted through intimate skin-to-skin contact, which means that you don't have to have intercourse to get HPV. Any kind of genital, anal, or oral contact can spread the virus. This is why using condoms and dental dams can reduce the risk of transmission, but they don't eliminate it completely. For most people, HPV infections go away on their own without causing any symptoms. The immune system is usually able to clear the virus within 1 to 2 years, but in some cases, especially with certain high-risk types, HPV infections can persist and cause more serious health problems. These include genital warts and, in some cases, cancers of the cervix, vulva, vagina, penis, anus, and throat. Cervical cancer is the most well-known cancer linked to HPV. Nearly all cases of cervical cancer are caused by persistent infections with high-risk HPV types. This is why regular cervical cancer screening, such as Pap smears and HPV testing, is so crucial for early detection and prevention. But HPV doesn't just cause cervical cancer. It's also responsible for a significant number of other cancers in both men and women. Despite the potential health risks, there's good news. HPV-related cancers are largely preventable. One of the most effective tools we have is the HPV vaccine. The vaccine protects against the types of HPV that are most likely to cause cancer and genital warts. It works by stimulating the body's immune system to produce antibodies that will recognize and fight off the virus if you're exposed in the future. The HPV vaccine is recommended for preteens, both boys and girls, typically at ages 11 or 12, but it can be given as early as age 9. The reason for vaccinating at this age is simple. It's best to get the vaccine before any exposure to the virus, which can happen as soon as someone becomes sexually active. However, if you didn't get vaccinated as a preteen, it's not too late. Catch-up vaccination is recommended for everyone through age 26, and in some cases, adults up to age 45 can also benefit, depending on their risk factors. Getting the HPV vaccine is safe, and it's been shown to be highly effective in preventing infections with the most harmful types of HPV. Since the introduction of the vaccine, rates of HPV infections and related diseases have dropped significantly in countries with high vaccination coverage. Common side effects are mild and temporary, such as soreness at the injection site, headache, or a low-grade fever. Serious side effects are extremely rare. It's natural to have questions about any vaccine, especially one that's recommended for young people. Some parents worry that giving the HPV vaccine might encourage earlier sexual activity, but research has consistently shown that this is not the case. The vaccine is about cancer prevention, not about sexual behavior. In addition to vaccination, there are other steps you can take to reduce your risk of HPV infection and related health problems. Practicing safer sex by using condoms or dental dams during sexual activity can lower your risk. Although, as mentioned earlier, they don't offer complete protection. Limiting your number of sexual partners and avoiding sexual contact with people who have visible warts or lesions can also help. Regular screening is another key part of HPV prevention, especially for people with a cervix. Pap tests and HPV tests can detect changes in cervical cells before they become cancerous, allowing for early treatment and better outcomes. Talk to your healthcare provider about the right screening schedule for you, based on your age and health history. For those who do develop HPV-related health problems, there are effective treatments available. Genital warts can be treated with medications or removed by a doctor. Precancerous changes in cervical cells can often be treated before they turn into cancer. And if cancer does develop, early detection can make a big difference in treatment success. It's important to remember that having HPV is nothing to be ashamed of. The virus is so common that almost everyone who is sexually active will get it at some point. Most infections clear up on their own and never cause any problems. But by staying informed, getting vaccinated, and keeping up with recommended screenings, you can take control of your health and significantly reduce your risk of serious complications. Misinformation about HPV and the vaccine can spread easily, so rely on credible sources like the Centers for Disease Control and Prevention, the World Health Organization, and your healthcare provider for accurate information. If you have questions or concerns, don't hesitate to talk to a medical professional. They're there to help you make the best decisions for your health and your family's well-being. In summary, HPV is a very common virus that can lead to serious health problems like cancer, but it's also largely preventable. The HPV vaccine is a safe and effective way to protect yourself and others from the most harmful types of the virus. Combine vaccination with regular screening and safer sex practices, and you'll be doing your part to reduce the impact of HPV in your life and your community. Remember, knowledge is power, and by understanding HPV and how to prevent it, you're taking an important step toward a healthier future.